What is infertility? A question that is often asked but not always fully understood. Infertility is generally defined as the inability to conceive after a year or more of unprotected intercourse. For women over 35, this period is typically shortened to 6 months due to the steady decline of fertility with age. These definitions, while useful for data collection, are not intended to guide treatment decisions or the provision of fertility care services. When individuals or couples face difficulties in conceiving, they often turn to reproductive endocrinologists, specialists who focus on managing infertility. These medical professionals can also provide support for women who have experienced recurrent pregnancy loss, defined as 2 or more spontaneous miscarriages. But how, one might ask, does conception actually occur? It's a complex process involving multiple steps. To start with, a woman's body must release an egg from one of her ovaries. This process is known as ovulation. Next, a man's sperm must join with this egg, a step known as fertilization. This usually happens in the fallopian tubes, which connect the ovaries to the uterus. Once the egg is fertilized, it begins a journey through the fallopian tube towards the uterus or womb. The final step in this process is implantation. This is when the fertilized egg or embryo attaches itself to the lining of the uterus. Once implanted, the embryo can grow and develop into a fetus. However, infertility can occur if there's a problem at any one of these stages. For instance, ovulation issues could prevent the release of an egg. Issues with fertilization could prevent the sperm from joining with the egg. Problems with the fallopian tubes could prevent the fertilized egg from reaching the uterus. And issues with the uterus could prevent the embryo from implanting properly. In addition to these, there's a condition related to infertility known as impaired fecundity. This refers to women who have difficulty getting pregnant or carrying a pregnancy to term. In summary, infertility is a complex issue that can arise from problems at any stage of the conception process. It's defined as the inability to conceive after a certain period of unprotected intercourse and can be managed with the help of reproductive endocrinologists. Whether it's issues with ovulation, fertilization, the journey of the fertilized egg, or implantation, each step of the conception process plays a vital role in achieving a successful pregnancy.